Welcome to our video on dental implant problems. I have seen multiple patients over the years who have had dental implant problems as a result of my role as a specialist dentist. Whilst dental implants are a highly effective, incredible way of replacing your missing teeth, it is really important that you're aware of the risks associated with them, and I intend to use this video to give you all the information to make the right decisions for you. The first implant problem is just implant failure. In other words, the dental implant does not fuse with the bone. It occurs for multiple reasons, including poor oral hygiene, cigarette smoking, uncontrolled diabetes, perhaps implant misalignment, and issues to do with the density of your bone. Treatment for some types of cancer, including radiotherapy, can also increase the risk of implant failure. If an implant fails, it will need to be removed and replaced after the bone heals. To reduce the risk of implant failure, please answer all the questions that your dentist asks before surgery honestly and carefully, and also ensure that you religiously follow all of the post-surgical advice, namely use of mouthwashes, taking the antibiotics if required, and also quitting smoking, because all of these things will reduce your risk. Implant infection, also known as peri-implantitis, is an increasingly common condition that affects implants within a few years of placement. It essentially, very slowly, leads to loss of the bone, and if it is not kept in check, you will eventually lose the dental implant. To reduce the risk of this condition, please see your dental therapist or dental hygienist every 3 months. If your dentist recommends that you have a gum graft to get the tissues, the gum tissues around the implants thickened, then please accept it, because gum grafts almost act as a padlock around bone. They reduce the chances of you losing bone over an extended period. Obviously, keeping medically healthy, controlling your diabetes, and also quitting smoking is very useful. The next common problem is loosening or fracture of one of the implant components. Essentially, implant teeth comprise of the implant, which is the screw that goes into the bone, the beautiful tooth that you see, and a connector that connects the implant to the tooth. And any one of those three things could loosen or fracture. Loosening or fracture of the tooth or the screw that connects the tooth to the connector is the most common complication in this category. The next most common is a fracture of the connector itself, and the least common is a fracture of the dental implant. Please do not use your teeth for purposes for which they were not designed. For example, opening bottle tops or biting into other hard things. It is important that, if advised, that you wear a bite guard to stop yourself from clenching or grinding on your dental implant at night, and just being generally mindful of what goes through your mouth. You also need to make sure that your dentist is comfortable adjusting your bite so that the biting contacts are spread over a much larger surface area, and that reduces the load on the dental implant. The next issue with dental implants is nerve damage, which is fortunately very rare. It is obviously a very serious complication of a dental implant, and it usually happens if the implant is placed too close to the nerve that supplies any part of your mouth, leading to pain, numbness, or tingling after the implant surgery. To guard against this, please ensure that you use a very experienced implant surgeon, and you may want to use the General Dental Council's specialist list in periodontics, prosthodontics, and oral surgery to ensure that you satisfy yourself that your implant surgeon has the experience to carry out this procedure. In any case, this complication can happen to any of us, irrespective of our experience, and I include myself in this. And if you have any change in sensation that does not resolve itself within 24 hours, really important that you contact your implant surgeon immediately. Gum recession around the dental implant is an increasingly common complication after implant surgery. It usually happens within a year or two and occurs because the gum was either too thin to start with, the implant hasn't been placed perfectly, or the patient has poor oral hygiene afterwards. To prevent gum recession, please accept the gum graft if your dentist recommends it before implant surgery, in addition to religiously following the daily cleaning advice recommended by your dental hygienist or dental therapist. In conclusion, dental implants are a safe and highly effective way of restoring your smile and improving your quality of life. By maintaining excellent oral hygiene and choosing an experienced implant surgeon, you can reduce your risk of having any of those complications quite significantly. If you're considering having dental implant surgery, or you have concerns about an existing implant, please consult your local dentist and he or she will be able to help you. The most common issues around dental implants include loosening of one of those components, tooth, connector, or dental implant, gum recession, which is unsightly and may not give you the look that you want, peri-implantitis, which is an increasingly common cause of slow bone loss over a number of years, nerve damage, which is really rare around dental implants. Dental implant problems cannot be entirely prevented, but risk of problems can be significantly reduced by answering all the pre-assessment questions honestly, following all the post-surgical advice really carefully, and after everything has healed, ensuring that you see your dental hygienist or dental therapist every 3 months, ensure you don't smoke, and also making sure that you use your electric toothbrush and interdental brushes really effectively on a daily basis. Signs of implant failure include redness, pain, loosening of the implant shortly after it's been placed, or perhaps years later, and a significant change in the way the implant feels and functions. Dental implant problems can often be fixed, but the type of treatment will depend on the situation. In extreme cases, it may actually involve removal of the dental implant and replacement down the line, or perhaps antibiotics, or more intensive maintenance programs afterwards. Dental implants are designed to be a long-term solution, by which I mean they should last 10+ years. The life of the implant will depend on how well you look after it, the skill of the dentist that placed the dental implant, and your medical history. If you would like to ask any questions of me or my team, please complete the form below, and one of us will be in touch with you at the very earliest available opportunity. Thanks for watching.